My name is Matt Campbell. I am the owner of the Midwest Concussion Clinic, trying to start up our virtual series of once a month going through a monthly lunch and learn to talk about the world of concussions. Having some technical difficulty on my end, so I apologize for that, but hopefully we're up and running now and I'm not just talking to myself for the next hour. When we started looking at kind of ways to give back, my main focus is education and changing the way we manage concussions around our area and around the United States. When we start looking at concussions, it's one of the more hotbed topics in athletics, but what people don't realize is concussions don't only happen inside of athletics. They're actually really a lot more common than you may think. During today's Lunch and Learn session, I am going to talk about what goes into concussion rehab, what everything kind of means, what it stands for. I'm going to talk about some common components of concussion rehab, some uncommon components of concussion rehab, things that you may not realize go into treating concussions. And then we're going to touch on what the importance of concussion rehab and why I am so passionate about it overall. When we start looking at concussion rehab as a whole, a lot of people that have been through concussion rehab or have heard of anything that has to do with concussion rehab will focus on, okay, it's physical therapy. Okay, so when we look at common themes with concussion rehab from a physical therapy perspective, we look at treating the cervical spine. Right? Most concussion patients will hear of some diagnosis of whiplash, especially if they're treated from a car accident or treated for something that may cause some issues with upper cervical tension, upper cervical pain. If I have somebody who's been involved in a car accident or has been involved in a concussion event and they end up going to the hospital for concussions, generally they're going to look at the neck and kind of treat the neck in terms of, hey, let's look at it and treat you for whiplash. When you go to a physical therapy appointment and you're talking about, hey, I was in a car accident, the first thing that they're going to do is they're going to go through a thorough evaluation of your upper cervical spine and your shoulders. They're going to look at what kind of damage was done in the accident. Did you strain muscles? Did you sprain ligaments? Did you do any structural damage to the head and neck? And once they rule that out, they'll go through some treatment to kind of fix the upper cervical or whiplash aspect of the injury itself. If you have anybody that's going to focus on the concussion aspect in physical therapy, it kind of goes hand in hand, right? They're going to treat a lot of the musculature in the upper neck. They're going to go through what we call cervical mobilization. They're going to make sure that the joints themselves inside the cervical spine are translating and rotating the way that they're supposed to. They're going to look at strengthening the musculature of the cervical spine because most of the time, tension is not because there's structural damage, but usually because there's some form of muscle spasm or muscle weakness. After they get through treating the upper cervical spine, a lot of what physical therapy will do overall is they will treat balance and neuromuscular re-education. All that means is they're going to work on some upper cervical proprioception, knowing where you are in space, trying to make sure that your head and neck are on the same page as they move around through Earth, as they move around through the world or their environment. And then the balance aspect of things is they're going to train you to do different things in different stances on stable surfaces, unstable surfaces. They're going to do some things with you walking and talking and kind of chewing gum at the same time. They want to make sure that they have a way of kind of treating the balance aspects of it. Once you kind of look at physical therapy, those that have been through a little bit more of a kind of challenging concussion recovery or somebody who's kind of gone through concussion rehab recently may also be involved in some form of vestibular therapy. In my world, I get tabbed as vestibular therapy quite a bit. A lot of my extensive education is in vestibular therapy and vestibular rehabilitation. I am far from a vestibular therapist. But when we look at vestibular therapy is treating the dizziness associated with the injury. Now, traditional vestibular therapy and concussion vestibular therapy treatments are very different. Traditional vestibular therapy looks at the structure and the fluid movement inside the inner ear. Somebody who's had chronic vertigo often will refer to vestibular therapy as, quote, getting my crystals put back in. They may put you through different techniques and different movements to kind of roll the head and neck around to try to reposition some of the what are called protein crystals or otoconia inside the semicircular canals of the ear to kind of reestablish a baseline to make sure that those fluid movement is happening freely and we're not getting any blockage of fluid. That blockage of fluid inside the inner ear is what causes dizziness. After a concussion, we want to make sure that, number one, that's not happening overall. If we have a blocked kind of passageway through those semicircular canals, oftentimes patients will refer to the dizziness as the world is spinning or I'm spinning, and it has a rapid onset and it lingers for, about 10 to 15 seconds at a time before it starts to settle down and we get some after effects. Some of the after effects tend to be upper cervical tension. When the body does not feel comfortable with the dizziness or with any kind of aspect to its upper cervical tension or vertigo, we run into issues where the neck will get really tight so we don't move our head around. One of the common associated vertigo treatments or diagnoses with concussions is what's called BPPV, benign positional proximal vertigo. Generally, it's vertigo that lasts for a couple seconds up to 30 seconds and can be really, really intense. I don't wish vertigo on anybody. Vertigo is one of those things that is very hard and can be very scary in terms of its onset is really kind of uncontrolled and unpredictable. And when it happens, you're along for the ride. Vestibular therapy is designed to treat the vertigo associated post-concussion. Now, it's not just structural vertigo, though. You may run into issues with what we call visual vertigo, which is where the eye alignment doesn't track well or the eye movement isn't moving in a stable pattern or a consistent pattern, sending in consistent images that the brain can interpret post-concussion. When we look at vestibular therapy in the visual vertigo, oftentimes we will pair vestibular therapy with occupational therapy to work on vision training and vision movements and eye movements. Vestibular therapists a lot of times are tabbed with treating concussions for their practices because of some of the similarities that go along with concussions and vestibular impairment. The problem is treating concussions with traditional vestibular therapy is only effective between 20 and 30% of the time. So you're looking at 1 in every 4 generally will recover from their concussion if they're being treated with strict vestibular therapy alone. It's one of those areas that's looking at more and more of a research base currently, and they're trying to figure out what components of vestibular therapy are working well with concussion recovery and what they're missing. And generally treating somebody with traditional vestibular therapy post-concussion is not as effective as treating the whole system. The third common area that we look at with concussions and concussion therapy is a form of what we call cognitive therapy. Oftentimes it's completed with a speech therapist or a speech pathologist. A speech therapist training is extensive across the board and not just the cognitive aspect. They do everything from swallow studies and making sure that you're able and healthy enough to drink water if you're ever in the hospital, whether you can eat a normal diet, all the way up to teaching you how to read, teaching you how to talk and speak, and then on the brain injury side, retraining your cognitive abilities. In my opinion, it should be referred to as cognitive therapy, but that's a whole nother argument that we can have. The speech therapy world and the speech therapy's involvement in brain injury recovery is a massive component to making sure that people recover completely from their concussion. When we start looking at cognitive therapy, cognitive symptoms tend to be the scary thing for most of our patients. Physically, they can handle it. I get some headaches, I get dizzy, I know where my limitations are. They learn very quickly what they can and can't do and what causes symptoms to flare up overall and over the course of time. The challenge is when you forget, when you lose memories, when you lose the ability to pay attention and focus, it's the one that can scare patients, especially if they haven't been educated on it. Think about it. If you're walking down the aisles of Walmart and don't remember where you are, it would make you very, very concerned. It would make you very nervous and it would get you very scared. If you're having a conversation with somebody and they look at you like, yeah, man, we talked about this already. We've gone through this with you already. That can be very concerning for a patient if they forget that. Cognitive therapy will focus on a couple of different areas. Following concussions, the primary areas that they will look for is they will do objective testing to measure the memory, the attention, and the focus of a patient. We will go through what's called single and dual task assessments post-brain injury. Single task assessments. You and I are sitting here in a calm environment, calm room. There is one exercise, or there's one test that we're doing. And once we finish with that test, we'll move on to the next test. The dual task component is now we have two different things that we have to keep in mind and we have to keep track of during this assessment or during this exercise. Dual tasking is a wildly unrepresented kind of treatment approach when it comes to concussion rehab if you are treating with somebody who does not normally treat concussions. It's an easy way to overload somebody symptomatically, and it's an easy way to confuse a patient if you're not careful. When we're looking at our assessments from the initial evaluation, we can have patients that do really well when they are sitting still in a calm environment, moving their head or moving their eyes in one direction to make sure that they're able to kind of focus and pay attention. Implementing a dual task component to the initial evaluation is key to actually teasing out what deficits may be present post-concussion, and it's the one thing that we have to focus on throughout the entirety of our concussion rehab to ensure that somebody is recovering the way that they're supposed to. If you think about your daily lives, how often are you only doing one thing at a time, right? I'm answering an email. I'm carrying on a conversation. Most of the time we're going through dual tasking. I'm walking and talking to somebody at the same time. I'm writing an email while somebody and I are, carrying on a conversation. I'm answering the phone and jotting down what they're saying or what they're telling me to make sure that I know what I'm supposed to be doing. We do dual tasking all day, and post-concussion, we lose the ability to do that dual tasking. As we look at cognitive therapy, not only are they trying to get you back to completing single and dual tasks, they're also teaching you different techniques to modify your day-to-day activities to ensure that you're getting good cognitive performance. Not only is it scary to forget things, it can be very frustrating. When we start looking at the mindset of a patient, it's something that we're going to talk about in a little bit. That's one of the more uncommon components of concussion rehab. But if I have somebody who's struggling cognitively and they are really scared, really nervous, really agitated, that irritation to the brain, that irritation and agitation overall in terms of their kind of physical and emotional presentation will cause an increase in physical symptoms and a decrease in cognitive performance. So not only do we help try to fix the underlying deficit post-concussion, we spend a lot of time talking about different modifications to daily activities and daily life that can help moving forward to ensure that we're not forgetting things. Now, cognitive deficits are very, very scary, and they can cause problems, right? If I'm going back to work and I don't remember how to do my job, not only can somebody get hurt while being at work, whether I'm, operating a forklift or I am, trying to ring up a cashier or I'm trying to, help somebody with their taxes, mistakes can cause some big issues. Now, if we have somebody who's making mistakes at work due to decreased cognitive ability, what happens is they might get fired. If they get fired, now all of a sudden we have this spiral of kind of a snowball rolling downhill. I'm fired from my job. That leads to mental health concerns. That leads to financial concerns, which leads to increased stress, which leads to increased cognitive symptoms, which leads to increased emotional symptoms and increased physical symptoms. It's a snowball that spirals downhill very quickly. So cognitive rehab tends to be one of those things that we need to implement very, very quickly, whether it's going to formal speech therapy or just focusing on the cognitive aspect of rehab with us in our office. So the common things that go into most concussion rehab components or most concussion rehab plans is some combination of vestibular therapy, physical and occupational therapy, and speech therapy. So what about some of the more uncommon components of concussion rehab? When we start looking at some of the uncommon things, it's not necessarily something that people are overlooking or people are purposely not putting into their concussion rehab, but it's something that we're seeing more and more is not getting implemented or not getting taught or talked about when you're dealing with somebody who doesn't treat concussions on a regular basis. One of the perks of my job is all I do all day, every day is concussions. I don't have to worry about anything else. So when we look at the overall severity of treating concussion injuries, treating concussions, and kind of the day-to-day impact on concussion research, I only have to know how concussions are changing. I only have to know how treating concussions needs to be placed. When you're still looking at somebody who works for a physical therapy clinic or somebody who specializes in all different types of injuries, whether they're orthopedic, whether they're cognitive, whether they're different types of traumatic brain injuries, they have to know so much about everything that a lot of times they get taught the basics, and then over time they learn how to implement these things as they treat concussion patients and they grow and expand. Okay, when we start looking at the uncommon components of concussion therapy, one of the first things that I will talk about is inflammation control. Inflammation, just like every single injury, becomes a problem over time. The difference between concussion inflammation and like I hurt my knee and my knee is swollen is right now with most concussion patients, they go through what's called neuroinflammation, which is essentially the body swells. Okay, so we're not looking at like, man, my knee is swollen and stiff and puffy, I need to get that swelling out of there. We're looking at systemic swelling. One of the reasons the brain goes through some inflammation, some neural inflammation post-brain injury is it's trying to get you to retain as much water as possible. Every cellular function that you do requires water. When the brain is hurt, it is stuck in a fight or flight response, and it is constantly using water to repair tissues. When we start looking at concussion therapy, we address the inflammation side of things a couple different ways. The easiest way we do it in the very beginning appointment, we talk about what supplements the brain needs to heal and what supplements we can use to help the neuroinflammation and the inflammation control overall. When somebody is hurt or struggling with a concussion, generally they are deficient in a couple different vitamins and supplements right off the bat. Most of the time we see patients are deficient in vitamins A, B12, C, D, omega-3s, magnesium, and creatine. That's a lot of different things that if you're not taking supplements or vitamins or you're having a balanced diet, we see a lot of the deficits in those vitamins right off the bat. So when we start looking at the evaluation of the inflammation processes inside, the body post-concussion, we will recommend all of our patients start on some form of a multivitamin, magnesium, omega-3s, and creatine. The only way to know specifically which vitamins and minerals somebody is deficient in is to run a comprehensive blood panel. And it's something that we've done in the past if we have somebody who's just not recovering the way we expect. For most of our patients, starting on a multivitamin, adding in some creatine is an easy way to start. One of the other ways we can look at inflammation control is making modifications to dietary intake and dietary restrictions. The brain does very well on an anti-inflammatory diet post-concussion, but anti-inflammatory diets can be really, really challenging for patients to follow because of the amount of salt that we take in the American diet. When we sit down and talk with patients that are struggling with their concussion recovery, persistent post-concussion symptoms, or overall feel like they've hit a plateau, we will start to dig into the inflammation control in the dietary side of things. When we talk about disruption of chemicals inside the brain post-brain injury, that neurometabolic cascade, the enzymes that the brain needs to heal and can kind of repair tissues are created inside the lining of the stomach and transferred through a super fast highway up to that blood-brain barrier. The gut is considered the second brain for a lot of people. If we're not addressing the inflammation side and the gut health post-concussion, we're missing a major piece of the overall recovery that leads to people not recovering completely and having lingering symptoms over the course of months or even years. Inflammation control is something that we dig more and more into the farther down the road that we get in concussion management. Not that it's not important right away, but it's also something that can be very hard for patients to modify right off the bat. The second uncommon component that I implement into my concussion rehab plans is a massive focus on mental health. Mental health is one of those topics that has been taboo for a long time, and thankfully things are getting easier and things are getting more kind of traction when we start talking about mental health. The mental health component of concussion therapy is multifactorial. The first thing that we look at is following a concussion, there is a massive change to chemical composition inside the brain. Concussions are a brain going slower than it wants to electrically and physically, and a chemical and hormone imbalance. If we look at the basic definition of what depression is it's a brain processing and working slower than it wants to with a chemical and hormone imbalance. They are the exact same thing. So if we're not addressing the mental health side of concussion recovery or the mental health side of the injury itself, we aren't addressing a major factor that can be really dangerous to our patients. We have to assess the mental health overall because not only do we see a link between decreased mental health and concussion, the acute concussions, the longer somebody deals with mental health or concussion symptoms and the longer somebody doesn't feel good, the harder it is to remember what good feels like. We kind of get stuck in the mud. We don't remember how far we've come. We don't remember how much farther we have to go. We kind of fall into a trap where we wake up the same, go to bed the same. Everything kind of falls into play, where it's the same thing over and over again. I like to talk about the old movie Groundhog's Day with Bill Murray. You wake up the same way, you go to bed the same way. You can almost start to, the longer you're fighting recovery, you can start to plan out, okay, I'm going to wake up with a headache. It's going to do this. I'm going to get a little bit dizzy around noon. I'm going to get nauseous by 4 p.m. And then I'm completely wiped out by the time I go home at 5. It's something that can really, challenge patients in their recovery. The old school treatment approach for sitting in a dark room and just resting is an outdated treatment approach because, number one, the brain doesn't recover as well as we used to think. It just gets really good at making compensations and kind of hiding problems overall. And number two, putting somebody in a dark room who doesn't feel good, completely isolating them away from their friends, their family, their job, school, athletics, taking them away from electronics and saying, hey, I want you to just sit here in the dark and think about how you feel. Good luck not getting depressed. When we look at the mental health treatment post-concussion, we do it a couple different ways. Number one, I am addressing mental health right off the bat. The way we work in my clinic is I refer to my patients all the time as people and not numbers. It drives me nuts in the healthcare world when everybody's focused on profits and getting people in the door and making sure that, I can only see you for this amount of time because I can't bill you for any extended amount of time. If you come in talking too long, I can't treat you because I can't bill you for that service. That's awful. That is a terrible way to look at concussion management. And that's why I've kind of gotten away from the insurance world through the virtual concussion clinic. I want to meet you where you're at. If you're having a great day and we want to talk about all the great things that have gone well, all the victories that you've had since we saw you last, wonderful. I'm the biggest cheerleader you got. I'm going to support you 110%. If you're having a rough day and we need to talk about why we're not feeling good, we're talking about bad things that have happened, not even concussion related. Hey, Matt, I lost my job. I was doing well, and now I've had a couple bad days in a row, and I don't know what's going on. I'm scared. I'm frustrated. I'm angry. We're going to talk about it. We're going to implement techniques to help you through that and not just ignore it. Like sometimes it can happen when we're looking at treating people, right? If I'm looking at an algorithm or I'm reading a treatment protocol and I'm just kind of treating a name on a paper or I'm treating an injury, I'm not treating the person. We're doing a major disservice to that person across the board, not even just concussion rehab, just across the board if we're not taking that person into consideration before their injury or illness. When we look at the mental health side of things, depression and anxiety are wild cards when it comes to concussion recovery. If we're not addressing them and not paying close enough attention to them, they can cause patients to spiral out of control very quickly. Okay? We've seen statistics. There's a lot of research when it comes to post-acute traumatic depression, and a traumatic brain injury depression is totally different than a traditional depression diagnosis. Oftentimes, traumatic depression or post-traumatic depression following a traumatic brain injury is what we call medication resistant. It presents completely different than what somebody may have already pre-existing been dealt with. A way I describe concussions is it generally doesn't cause new things to show up, but it puts a magnifying glass on some of the deficits that are already present. If we have somebody who's struggling with a longer term recovery, we have to focus more and more on what the depression side of things looks like. Concussions are kind of like a low burning grease fire. They burn slow, they're kind of hot all the time, and you have to kind of pay attention on them and babysit them to make sure that the concussion is not getting out of control. Anxiety is like taking a football and spiking it down into the middle of that grease fire. When you spike it down into the fire, the grease goes everywhere, and eventually the grease will settle back down into its slow kind of burning fire. Well, the problem is now that we've had that anxiety spike in the middle of it, the curtains are on fire, my kitchen counter's on fire, I got to put the fires out around the environment before I can come back and monitor that grease fire. We do a lot early on talking about mindset and parasympathetic relaxation. What is parasympathetic relaxation? Breathing. You would be surprised at how much we can get some benefit from concussion recovery by just sitting back and breathing. When symptoms are going up, remembering to utilize these parasympathetic relaxation techniques is key when it comes to overall concussion recovery. If we can teach techniques to help with mindset, mindfulness, positivity, the brain heals faster. And there's a lot of research out there that says a positive mindset is better for not only brain healing, but body healing. If you look at the two techniques in the medical world that have withstood the entire test of time, we're talking from the Ming Dynasty all the way to 2025. The only two treatments that have withstood the test of time overall is meditation and acupuncture. If we look at acupuncture, it's changed over the years, right? A dry needling that's getting a massive push through the physical therapy world is a form of acupuncture. It's a little bit different in its techniques, but it's a form of acupuncture. Reflexology, trigger point release are all different forms of acupuncture overall. Meditation looks different to everybody. When we start sitting down and talking with patients in terms of our treatment plans, I talk about meditation in terms of, hey, do you like to watch, birds? Do you have a fish tank that you like to sit there and watch? Do you do devotionals, right? Do you wake up every morning and read the Bible? Do you listen to podcasts or music? And, what is your happy place? And right away, my goal is to get that happy place activity to be asymptomatic, right? If I have somebody who's like, man, my favorite thing in the world to do is play video games. One of the first things that we're going to talk about is activity modifications to help make video games less invasive and to help make video games more tolerable symptomatology-wise to ensure that their happy place is somewhere they can escape if they're having a bad day. If I've got somebody who struggles with visual perception and visual kind of acuity problems where the vision goes blurry or they have double vision at times and their favorite thing to do is read, I have to find ways to modify the activity to get them back to reading. Whether it's audiobooks or reading physical books versus a tablet or a Kindle, we make modifications to ensure that the mental health escapes that they do on their regular basis can help us out overall. Not only will it help reduce physical symptoms, but if I can get somebody's happy place to be something that they revert to when they're having a bad day, or even as something that they can do to celebrate the victories, it can help with that positive mindset, and it can help kind of lead a patient through their recovery process by seeing small wins instead of only focusing on the negative aspect of things. I spent a lot of time talking about mental health because it's a huge component of concussion recovery that is so often overlooked. We have to be very careful with it. Not only do we talk about the parasympathetic and the happiness activities, one of the best things that we can do from a mental health perspective is physical activity and aerobic exercise, getting up and getting moving. The phrase movement is medicine has been coined for the last couple years, and it is no different post-concussion. Physical activity is one of your best friends post-concussion. Oftentimes, if somebody has not been educated on concussion rehab, they are still stuck in the mindset of, I want to lay low, I want to not do anything, and I want to make sure that I am focused on, going through my concussion recovery by not provoking symptoms. Physical activity helps concussion recovery, helps keep symptoms low, and is very, very beneficial for mental health management overall. It's something that we take a massive focus on in my clinic. That third different kind of component, or different, what I call the X factor, that often gets left out of concussion recovery is how all of these systems work together. Right? It's great that if we have somebody who can work on, upper cervical management, cervical mobility, strengthening, somebody who can work on visual tracking, somebody who can fix the vestibular issues, somebody who can help the cognitive side and the mental health side, that is great if they can work on them individually. Concussions, they have to be able to work on all of the systems together at the same time, and they have to make sure that they can modify it as we move forward. When I compare physical, vestibular, occupational, cognitive therapies treating injuries to concussions, I talk about the kind of protocols and the techniques that are in place to treat different injuries, right? Every surgeon has a different technique that they use post-joint replacement. Every therapist has a special technique that they've devised over the course of time and over the course of their careers treating different injuries. But most of them will follow into some form of, we fix A, we move to B. We fix B, we move to C. We fix C, we move to D. And everybody progresses linearly very easily. Now, I say this in generalization because that's not the way it works all the time. And oftentimes there are modifications that have to occur based on physical presentation. Patient has a setback, let's say they're an ACL repair. They were walking outside after therapy. Felt really good. They went home. They were walking without their knee immobilizer. They slipped on ice and fell. You come back into therapy the next time around, they're not going to sit here and say, oh, well, we fixed B, now we got to move to C. They're going to make modifications to their treatment plan. When we look at concussions, it is not linear at all. There is a lot of ups and downs. There's a lot of flow and ebb and flow into the treatment plans, into symptomatology overall. But if we're looking at treating concussions as a whole, we fix A, we move to B. Once we address B, we have to make sure that X didn't pop up. After we look at X, we have to make sure Q didn't pop up. Then we fix Q and we got to go back and make sure A still works the way that it's supposed to. There's a lot of jumping around that happens. And at times it can seem like it's a lot of helter-skelter activity. When I'm treating a patient, I have a general idea on what I want to work on before we even get into the appointment, based on where we were the last time I saw you, based on the trajectories and how things have been going overall. But you have to have somebody who knows what they're doing in terms of modifications and changes to the treatment plans to reflect where a patient is right now. Again, it goes back to my feelings of meeting somebody where they are. I have to make sure that if I have somebody who's struggling to see straight, they've got double vision, or all of a sudden we did an exercise and their vision is blurry, or they're seeing two of things, not only do I have to have the intelligence and the understanding of the injury itself to make modifications to the current treatment plan, I have to find a way to correct the visual disruption that we've got to make sure that they don't have a kind of a spiraling out of control and a massive fluctuation of symptoms. The X factor in concussion recovery is understanding the complexity of the concussion itself, what systems are invested, what symptoms are involved, what symptoms may be present the entire way through concussion recovery, and what may pop up based on the symptoms that we're treating or the deficits that we're trying to address. Being able to fluctuate treatment plans is what sets concussion recovery apart from traditional physical therapy or traditional vestibular therapy. It is what makes concussion therapy unique. We have to be able to assess the individual systems, we have to be able to treat the individual systems, and then we have to make sure that we can treat and integrate them all together while keeping focus on the ebb and flow and the up and down of a day-to-day presentation post-concussion. Concussion rehab is a component of common things. It's a component of uncommon things. But one thing that I will, stand on my soapbox and I will preach till the end of time is the importance of getting rehab post-concussion. I hear it a lot with my concussions, especially with my my long-term concussion recovery, my post-concussion syndrome, my persistent post-concussion symptoms, however you want to diagnose or however you want to call patients that have symptoms that have lingered for longer than, 30 days overall. We start looking at the importance of concussion rehab. Hey, I was in a car accident. They told me at the emergency room or my physician that, my scans were normal and I'll be better in a couple weeks. A couple weeks go by. I still have headaches. I still get dizzy. I still get nauseous. But nobody really talked to me about what to do if that couple weeks process goes by and I don't get better. Every now and again, I'll get treatment referrals from another healthcare provider, somebody, in the physical therapy world or the chiropractic world or the occupational therapy world. And they're like, hey, something's just not presenting correct or something's not going well in this, in this patient's presentation. And I will circle back to the importance of the totality, the overall picture of what concussion rehab really is. And a lot of times I can boil it down into three kind of reasons or three things that, focus on why we want concussion rehab implemented. The first one is there is a scientific and research proven faster recovery if we can get you involved in a guided modification or a guided treatment plan as early as possible. The research tells me that if we can get started within the first 48 hours, recovery goes a lot faster, more smoothly. Overall, we make sure that the process itself just kind of goes better if we can get started in treatment early on. Education, talking about why we're not doing the strict rest, why we're implementing, an individualized and specific concussion therapy and concussion rehab program for you to make sure that we're fixing the underlying deficits and addressing the neurometabolic cascade as it comes on. The 30-day mark is another major milestone when it comes to concussion rehab. If I have somebody whose lingering symptoms have been there for longer than a couple weeks, it's exponentially easier to help correct the issue and get you back to your normal life and normal routines asymptomatic if we can get started within the first 30 days. I see it a lot with patients. I have a general idea of what's going on. I know it's a concussion. I know I need rest. So I just try to manage it on my own. Every now and again, we'll get a patient that comes in, reaches out and says, hey, Matt, I need an appointment. We get something scheduled and they're like, hey, I'm feeling pretty good today. I think I'm going to just continue to recover on my own. I have a very weird business model because my hopes in life is to never meet anybody that needs my services. I never want people to get hurt. I hate having patients come in and saying, I was in a car accident. I was playing basketball and got elbowed in the face. I fell down on the ice. I was involved in a violent dispute. I absolutely hate that. But I will tell you that I am here for you and I am going to help fix the injury if and when it occurs. But concussion rehab has been proven to make your recovery times not only faster, but more smooth and a more fluid process with less symptoms overall. That leads me into the second component, which is we can reduce symptoms. A common theme for people that have tried concussion recovery on their own or have been through the physical vestibular occupational therapy component treatment session or treatment plans is that powering through symptoms will make symptoms worse. Mind over matter is a very real thing in terms of kind of illnesses, physical limitations, physical injuries, but it is something that is very kind of dangerous or counterproductive when it comes to concussion recovery. My go-to phrase is, mind over matter is great until the mind is what's the matter. And then we run into some major deficits, major difficulties if we're trying to power through symptoms. By just implementing the education side post-brain injury, post-concussion, we can get a patient to understand that listening to your brain and working with your brain, not against your brain, is very important to concussion recovery. Implementing a guided and strict concussion rehab protocol can help reduce symptoms overall, and it helps us by grading and slowly integrating us into different stimulus as we fix some of the underlying deficits to improve quality of life overall. The third major component that we look at concussion rehab and the importance of why we want to get started in concussion rehabilitation is we lower the risk in recovery. There is no such thing as concussion prevention, but once the brain has gotten hurt, it is at a higher risk for some life-threatening injuries that may occur if we get hurt or if we have another concussive event again. The reason we talk about the importance of concussions in athletics is there is a phenomenon called second impact syndrome, which can be fatal if it occurs in people under the age of 18. So we want to make sure that we're protecting young athletes and young kids from their injury and kind of from themselves. Let's be honest, with kids, they do a lot of different things that lead to a higher risk for hitting their head in general during their day-to-day activities. But if we're looking at our adults, it's uncommon. It's not uncommon for adults to be symptomatic for a long period of time without getting treatments. There's a recent research study that says up to 50% of concussion patients will be symptomatic at 6 months. You think about it. You're getting told that you're getting better in a couple weeks, and 6 months down the road, you're still dealing with symptoms. Naturally, human nature, we go to the internet, we start searching. You can get anything on the internet that tells you anywhere from you're being diagnosed with a brain tumor, you have dementia and Alzheimer's, you've got 24 hours to live, or you can get diagnosed with, hey, it's a concussion, it'll go away on its own, it's no big deal. The internet can be a dangerous place. Implementing a guided concussion rehab and concussion recovery protocol will not only lower the risk of re-injury, but it also lower the risk that you're doing things that cause lingering and long-term effects. One of the kind of primary topics that concussions get linked to in the big picture is neurodegenerative diseases, such as CTE, chronic traumatic encephalopathy, Alzheimer's, dementia. The neurodegenerative side of things is very scary, and it's a common theme that gets asked with my concussion patients that happen to be a little bit older. I didn't know if I was suffering from cognitive issues or if I was just getting dementia. I didn't know if it was old age or if it was something that was actually going on. It's common. And when we run into people who haven't been, taught about concussions, or there's no concussion rehab that's been implemented, it can be scary in terms of they don't have any idea what's going on, and they're just downplaying the severity of the symptoms out of fear, or out of kind of concern that maybe something more life-threatening is going on, and they just haven't figured it out yet. I hope during today's lecture and during today's Lunch and Learn, you kind of learn the common themes that are with concussions, the uncommon components of concussion rehab, and the things that I base my clinic on. And, I will focus on what separates me from somebody who just treats concussions to the Midwest Concussion Clinic and how I only treat concussions. And then I want you to be able to understand what the importance of concussion rehab is. The earlier we can get a guided, individualized, specific to you treatment plan in place, the faster you recover, and the less you have to see somebody like me. Again, that's the whole goal of my concussion treatment plans, is the less I have to see you, the better. I want you to have the tools to recover. I don't want you to become dependent on coming in and seeing me. But if something happens, I am here for you, and I will tell you that the expertise I have in concussion rehab is really important overall. I appreciate you guys joining me today. If you watched it live, I apologize for all the technical issues. I'm hoping this actually recorded and went out live and I just haven't been talking to myself. If we find out that I have been talking to myself, it's going to go up as a video that you can watch, and you can go through and check out the highlights on it. Every third Wednesday of the month, I'm going to go through a Lunch and Learn very similar to this one. Hopefully next month I won't have the same technical difficulties and we'll be up and running faster. But the third Wednesday of every month at 12 p.m., we're going to do a Lunch and Learn. If you have more questions or you want to know more about what concussion rehab is, you can follow me on my social media accounts. I'm at MW Concussion on all major social media, Instagram, X, Twitter, TikTok. We're the Midwest Concussion Clinic on Facebook and YouTube. If you have specific questions that I haven't answered or addressed and you want to know what's going on, feel free to shoot me a DM. Shoot me a text at the office number there, 260-200-3735. Email me at matt@mwconcussion.com. I will gladly answer any questions that you have. If you're somebody who's struggling with PCS or PPCS and wants to kind of get a handle on your concussion recovery, reach out. I'll talk to you about what kind of treatment plans we can do, and let's schedule a consultation to figure out how we can help you take your recovery back into your own hands. Again, My name's Matt with the Midwest Concussion Clinic. We are now a virtual Midwest Concussion Clinic, bringing 100% virtual concussion rehab at the comfort of your own home. I want to meet you where you're at and make sure that we can get you to recover as fast as possible. Thanks for tuning in. Hopefully you learned something today, and I hope to see you at our next one, the third Wednesday of every month at 12 noon Eastern Time. Thanks.